Today, Governor Mike Parson and the state health department reminded Missourians the importance of vaccinating the most vulnerable population right now and not skipping the line. Thanks for joining us at 6:30. I'm Deborah Kendrick.
And I'm Lucas Geisler. So far, more than 450,000 Missourians have received their first dose of the coronavirus vaccine, but eligible Missourians are still waiting for their shots. State health officials and the Missouri National Guard are continuing to conduct mass vaccination clinics in an attempt to vaccinate more of the vulnerable population in Phase 1B, Tier 2. The governor says if people choose to get vaccinated before their phase, there will be consequences.
The guidelines are clear. There is no misunderstandings. So this is part of the process that we're going to put in place to be able to help that group that is in that tier, and we are going to maintain that. If that is not followed, then we will do other actions.
Dr. Randall Williams with the State Health Department hopes to have the general public all vaccinated by June or July. Within the last hour, Cole County has reported new COVID-19 cases. The county health department reported 15 new cases today. None of those cases were found in long-term care facilities. There have been 7,738 total cases since the pandemic started.
Boone County has reported another COVID-19 related death today. According to the health department, the patient was over the age of 80 years old. So far, 71 people in Boone County have died from the virus. There were also nearly 35 new cases of COVID-19 reported since yesterday. Around 16,800 people in Boone County have tested positive for COVID-19 since the pandemic started. As mass vaccinations make its way to mid-Missouri, we are asking local health experts your questions about the rollout and the vaccine itself.
Tonight, we're joined by Columbia Boone County Health Department spokesperson Sarah Hum and pharmacy head for MU Health Director Brad Myers.
Thank you both for joining us tonight. We appreciate it. Sarah, this question will be for you to first start off here. Every single day recently, we've been seeing new cases starting to drop across the state and also in Boone County. What factors would you say are leading to this drop? Would you be able to say that the vaccine is a big reason for this?
Sure. I think it's hard to say definitively so far that the vaccine is the reason for that, just because the numbers are still low of the percentage of folks who have been vaccinated in Boone County. But it could be a number of things. You know, we like to hope that the numbers are not as high of positive cases because people are following our guidance of staying home and wearing masks and such. But also need to consider that the amount of people who have already tested positive and maybe have some of those antibodies. And so there could be a number of factors of why folks we're seeing less and less numbers per day. And granted, you know, that always could change. We are hopeful that these numbers are going down. That's a good sign, but that doesn't mean that they won't go back up. So we're still encouraging folks to wear their masks, social distance, and stay away from large gatherings.
I want to ask about the number of people vaccinated so far. Brad Myers, this will be a question for you. How many has MU Healthcare done to date? Obviously, the start of a big event there at Faurot Field starting today and going for the next couple. And can you say how many people at MU Healthcare have gotten vaccinated? Of course, in that Phase 1A earlier. How many at your job have gotten the vaccine?
Absolutely. In Phase 1A, when you include employees that are patient-facing, clinical faculty, as well as student learners, we were able to vaccinate approximately 5,500 employees, which is about 60% of our workforce that would be eligible to receive the vaccination. Today at Faurot Field has been an amazing event. We are running the clinic from 7 a.m. to 7 p.m. And as of about 5 p.m. today, we had approximately 1,900 citizens that have received their vaccinations today.
Okay, great information there. Now we've, for both of you to answer this question, we've done a lot of stories, and I think just recently talking about the older population and people that are at most risk, but they may not have access to the internet per se, or even to a cell phone. In order to fill out that survey, all they have is a landline. So for each of you to answer, what resources do you have available, or are you working on more resources to really target that population that needs a little bit of extra help here?
Sure. So, we have our online survey that we use, but there's also a phone number that folks can call. And I think one of the really important things that the health department will be able to do in the coming weeks and months is as MU Healthcare is acting as the mass vaccination location, that leaves a room for the health department then to really focus on some of those folks who have some barriers to, whether that's, language barriers, transportation barriers, and internet access barriers, and folks who have a harder time getting information. We expect that we'll be able to really focus on helping folks that fall into that category that don't have those kinds of resources that may prohibit them from being able to get to one of the mass vaccination clinics.
And I'm going to echo Sarah. In addition to the survey link that is published on the MU Healthcare website, we also have a call center that has been set up with dedicated resources for individuals that do not have internet access. I do want to make it clear, this is mass vaccination is available for all members of our community in our region, not just MU Healthcare patients.
Would you mind each of them? Sarah, we'll start with you. You mentioned some phone numbers.
Yeah.
Not many people maybe watching the television with paper and pen. Would you mind just saying those phone numbers really quickly? We'll make sure that we also could get that information. It's been a big question that people have had for us as well on how they can get signed up. Could you just say those numbers aloud just so we can get that out?
You'll have to give me a second to look it up.
Okay, that's fine.
I can't say that I have it memorized.
We can get back to you on that number.
Absolutely. Now, I do want to ask, something that we're seeing in some nearby communities is National Guard, not really sponsored, but National Guard events in which they're working with local health departments to put on mass vaccination clinics. This will be happening in Cole County tomorrow. We saw it last week over in Audrain County. Sarah, maybe a question for you. Are there any events like this in the works that the Boone County Health Department is working on, maybe the Guard or some other agency to help put on something like this? Is anything in the works?
Sure. So right now, we're not aware of any of mass vaccination clinics from the Missouri National Guard that will be happening in Boone County. Our understanding is that those locations will be released week by week. And so, at this point, we're not aware of any, but that doesn't mean there won't be in the future. So we're obviously keeping in touch with our partners at the state and obviously here locally as well. So if that does happen, that the Missouri National Guard does have a clinic in Boone County, we'll be sure to get the information out to our residents. But at this time, we're not aware of anything.
Okay, thank you so much, Sarah and Brad. And they're not going to go very far. We're going to have them come back later in this newscast to answer some more questions for our viewers tonight.
Up next on 80.
Welcome back. Now, we are interviewing some MU Health experts when it comes to the vaccine rollout, and also the Boone County Health Department when it comes to the vaccine rollout, and also any questions that we've been getting about the vaccine itself. We are both joined by Sarah and Brad. And both of you, thank you so much for joining us back here today. One of the questions that, I think we've had here, and also probably viewers at home are also wondering, is the delivery chain of the vaccine. How exactly is this working? Is it going directly from makers to the hospitals, the health departments, pharmacies? Can you kind of give us a little bit of an understanding, a little bit more about how this is being done?
Absolutely. So the federal government, the way the process flows is the federal government tells the state at a routine interval what that allotment of vaccine will be allocated to the state. And from that allocation, the new state plan will allocate a certain percentage of those doses either to health systems or to health departments. How we receive the vaccine is typically we receive confirmation directly from the manufacturer, and we receive those doses straight from the manufacturer.
Sarah, as a follow-up question, from what we've seen so far, a lot of local health departments have been left out of this sort of initial distribution of vaccines. Have you gotten any word or any sense from your state partners? Will that change in the future? Will the health department itself be getting some vaccines in the future?
Sure. So our understanding with the new state guidelines of vaccine distribution is that local health departments each week will be splitting about 6,000 doses of the vaccine. So, that doesn't mean that we might get it every week. We might, that's still to be determined. And so that's one thing that we'll just have to see what happens as far as the rollout of that, which, that's a lot less than we thought that we might get. But again, we're working with our partners at MU Healthcare and Boone Hospital to make sure that we're serving our community the best that we can, and using our resources to reach folks who, again, maybe not be able to attend one of those mass vaccination clinics. And so we're still working on those details. But even though it's not the quantity of vaccine that we thought that we might get, there's still a role for us to help serve our community.
Now, Johnson & Johnson, to talk about just some late-breaking news that came out today. Johnson & Johnson has just asked for federal approval of its one-shot coronavirus vaccine. Brad Myers, what do you know about this vaccine? What can you share about the things maybe you've seen on it? And what do you think do you think if it gets approval, will MU Healthcare be using it?
Great question. At this point, we will wait for the emergency use authorization. There's currently very little information that's available. There is some published information on the efficacy of the Johnson & Johnson vaccine. One of the huge pluses to the vaccine from Johnson & Johnson is that it's a one-time shot versus a two-dose series. But we're going to trust the process with the FDA and the emergency use authorization process, and that's typically we receive our information once FDA releases more of the details.
All right, I'm sure a lot of vaccinators will be anxiously awaiting those details as well to see what happens. Brad Myers and Sarah Hum, stay with us. We'll have them coming back later in this show.
Welcome back. Tonight, local health experts have been providing some more information on mid-Missouri's coronavirus vaccine rollout and also the vaccine itself. Now, we are joined by Columbia Boone County, Sarah Hum, and also Brad Myers with MU Healthcare. Now, we were just talking to you during commercial break here, and we've actually had viewers call in asking us some more information on what other resources are available for those that may not have the internet or, a cell phone to get access to that survey. Now, can you repeat some of those things that you were telling us about as far as the availability for them?
Yeah, sure. So for the Columbia Boone County area, folks can call 573-874-CITY, which is 2489. And they'll speak to a person if they call during business hours. If they call after hours, they can leave a message and they'll get called back. And basically, they will fill out the information survey for them. And basically, if it's used for if we have standby vaccines or information, then those folks would get a call. Most of our information is done through email, but we do call people if they do not have an email address.
Similar process to Sarah at MU Healthcare. We have two ways or two means to sign up for the survey. One is to navigate to muhealth.org, and at the top of the webpage is a direct link to sign up for the survey. And then two, those community members that may not have internet access, we have a direct phone line, which is 573-771-CARE. It's 573-771-CARE.
All right, that's all fantastic information. Thank you. We'll also make sure that we have that in future newscasts as well on how to do. We've gotten many calls on that. I want to ask too about transportation. Mm-hmm. Do either of your agencies offer, I know there's some private partners out there that may help with this. Some people concerned about how they're going to get to a vaccination site. Do you offer any sort of appointments for pickup, or where would you direct people to go on that?
Currently, the health department is looking at ways that we can meet the needs of folks who have transportation issues. At this time, it's not like we're offering transportation to people, but we're figuring out ways that we can help people who can't get to a mass vaccination clinic. So hopefully we'll have more information to share with folks in the coming weeks on that.
And Brad, just very quickly, any offers they have? We got about a minute left.
I'm going to echo Sarah, same process. Here we have our mass vaccination at Furrow Field, and at this point we do not offer transportation, but that is one of our items that we're going to be pulling together the health department, Boone Hospital, and MU Healthcare to have discussions in this next week.
Awesome. Well, thank you so much, Brad and Sarah, for joining us tonight. We really appreciate your insight on this.